All right, so today we're going to dive into how one pretty unique rural region is completely flipping the script on health inequity. Instead of just waiting for some top-down solution, they're building a healthier future from the ground up. And honestly, their story offers a powerful blueprint for communities just about everywhere.
Now, to really get what's happening here, we first have to understand the place itself. And trust me, it's a region that doesn't fit neatly into any one box, or even just one state.
Okay, so take a look. This is the Columbia Gorge. I mean, it is just stunningly beautiful, right? But it's also this really complex patchwork of counties that are in both Oregon and Washington. And that creates some really unique challenges for public health, which, as we all know, doesn't exactly stop at state lines. So, what's the core problem that this community decided to just tackle head on? Well, it's a challenge that goes way deeper than just, being able to get to a doctor's office. It all really kicks off with this incredibly powerful vision. It's this fundamental belief that your zip code just shouldn't be your destiny, that things like your background or your identity shouldn't determine your chance at a healthy life. And here's where things get a little tricky. The community figured out that the standard measurements, like the federal poverty level, they just weren't capturing the full picture. Because the Gorge is what's known as a housing-burdened community, the true cost of living and the real economic struggle people were facing was getting completely missed by the traditional data. So, in response to this challenge, the community didn't just sit around and wait for some outside solution to come save the day. Nope. They decided to build their own coalition for change. And so they formed the Gorge Health Equity Collaborative, or GHEC for short. Its mission is actually pretty simple, but it's also really profound. Bring everyone to the table, share resources, and push every single organization in the region to make health equity a top priority. Their real strength comes from just how broad this coalition is. I mean, on one side, you've got the county public health districts. These are the real boots-on-the-ground government agencies. And then on the other, you have major medical providers like Providence Health and Services. But the collaboration also includes these absolutely crucial players who manage and coordinate care across the whole region, like Pacific Sources Coordinated Care Organization and the Columbia Gorge Health Council. Now, these are the groups that are all about connecting the dots of the healthcare system. They're making sure a patient's journey from, say, a clinic to a specialist to social services is as seamless as possible. And this slide, wow, it just brilliantly illustrates the depth of the collaboration. It goes way, way beyond just healthcare. We're talking social services, the education service district, and even the mayor of Hood River, all working together. This is what a true community-wide effort really looks like. Okay, so with this incredible collaborative in place, what tools are they actually using to build a healthier community? It turns out to be a fascinating mix of high-tech and high-touch. The first part of their toolkit really leans into the future. It's asking a super important question. How can modern, high-tech solutions help overcome those challenges of distance and access that are just so common in rural America? So one promising area is artificial intelligence. But now, we're not talking about the general AI you'd use for search query. No, this is about highly specific healthcare AI, tools designed from the ground up to help rural clinics with diagnostics, treatment planning, and monitoring patients. Another powerful tool is wearable technology, and the results can be seriously dramatic. One study that focused on rural older adults found that when a coaching program was paired with wearable devices, it led to an average step count that was nearly 4 times higher. Just think about that for a second. 4 times. But look, technology is only half the story. The other side of this modern rural toolkit is all about that high-touch, human-centered support. Because let's be honest, sometimes the most advanced tool is simply another person. And what's really cool here is the sheer range of human support they're offering. It is not just one thing. There's a free phone and text line for parents who just need someone to talk to. There are home visiting services that bring education and resources right to the doorsteps of new families. You've got peer support groups available both online and in person. And to top it all off, there are even community health workers dedicated to helping people navigate the absolute complexities of insurance and transportation. It's like a complete web of support. So what's the foundation that makes all of these tools, both the high-tech wearables and the high-touch home visits, actually work? Well, it all comes down to one simple but absolutely essential ingredient:
According to public health experts over at the CDC, real success in rural communities doesn't come from outsiders just showing up and imposing their solutions. That old top-down approach, yeah, it just doesn't work.
So the crucial point here is trust. It's basically the currency of public health in rural America. And it's incredibly fragile. You can damage it before you even start by using deficit-focused language or stereotypes that, paint rural life as a problem, rather than recognizing its strengths. And building that trust, well, that requires a deliberate, thoughtful approach. It means using respectful language. It means putting the lived experiences of the people who actually live there at the absolute center of the work. And it means engaging and empowering the trusted local partners who are already leaders in their community. This isn't just a checklist. It's the day-to-day practice that makes everything else possible. So ultimately, what the Columbia Gorge story really shows us is that real lasting progress happens when communities get to design their own future. It's all about blending innovation with deep collaboration, and then grounding it all in trust. And that leaves us with a final and pretty important question. The people of the Gorge are creating their own blueprint for a healthier, more equitable future. And it kind of makes you wonder, right? What does the blueprint for your community look like?